Today topic of discussion is renal function test. Renal function tests are divided into two main types. First one is to assess the kidney diseases. It include the commonly done test. First one is serum parameters. It include urea, creatinine, electrolytes, that is sodium and potassium. Another important one, urine analysis, along with physical property of urine and different chemical test for abnormal constituent of urine. Mainly estimate protein, sugars, bile salt, bile pigment, ketone bodies and blood in urine. So these are the tests to assess kidney diseases. What are the tests? First one is serum parameter. It include urea, creatinine and electrolytes test. Then urine analysis. By using different chemical test, we analyzes protein, sugars, bile salt, bile pigment, ketone bodies and blood in urine. Second types to assess the renal functions. What are the tests? First one is glomerular function or filtration. It include clearance test. To assess glomerular permeability, it include protein urea or urinary protein. To assess the tubular function, mainly assess the measurement of specific gravity. It include concentration test and dilution test. So to assess renal function, what are the tests we are using? Clearance test, then protein urea or urinary protein, then tubular function measurement by using that specific gravity, concentration test, dilution test. So these are the tests which are done to assess the kidney functions. So now we are discussing renal function test. First one is glomerular function. This one, glomerular function, that is glomerular filtration. What is the functions of kidney? It is responsible for various functions. First one, important functions of kidney to excrete metabolic waste, that is urea, creatinine and uric acid, etc. So first important function to excreted metabolic waste, urea, creatinine and uric acid. Then it is responsible for maintenance of acid-base balance and important in regulation of pH, important in regulation of blood pressure, maintenance of water balance, then maintenance of electrolytes level, that is sodium and potassium level. These are the important functions of kidney. Excrete metabolic waste, to maintenance acid base balance, regulation of pH, regulation of blood pressure, then to maintain water balance as well as electrolytes balance. Then kidney also responsible for synthesis of vitamin D, that is calcitriol, and synthesis of erythropoietin. It is a hormone produced by kidney. This one is the important role in production of RBC. So these are the two substances synthesis from kidney. What are the two substances? Vitamin D and erythropoietin. Important function to excrete metabolic waste via the kidney, the process of urine formation. Suppose this one is the Bowman capsules. This one is glomerular filtrate, ultra filtrate of blood except cells and protein. It contains all components that are presented in the blood, almost 180 liter per day. Glomerular filtrate, here filtration occur 180 liter per day. Second is reabsorptions of the content. Tubular reabsorptions. This filtrate which contain glucose, amino acid, sodium, potassium bicarbonate. These components get reabsorbed by the tubules. These components reabsorbed into the tubule reabsorptions. Third one is active secretion. The waste product directly secreted into the renal tubules. These are the three processes in urine formation: glomerular filtrate, reabsorption, then active secretion. Ultimately, only 1.5 liter urine excreted per day. 180 liter per day glomerular filtrate. 178.5 liter reabsorbed. 1.5 liter is excreted in the form of urine. This is urine formation in short. Now coming to the test for glomerular filtration. For the assessment of glomerular filtration, the test is known as clearance test. How we will define this clearance test? The amount of plasma or blood that would be completely cleared of the particular substances in unit time. How we will define the amount of plasma or blood that would be completely cleared of the particular substances in unit time. Three substances are generally used. What are the three substances? Inulin, creatinine and urea. Inulin, creatinine and urea. Among these three, inulin is the best because freely filtered to the glomerular, then it is neither reabsorbed not secreted by renal tubules. For this reason, it gives value 125 ml per minute. It has been given intravenously. Second one is creatinine. Creatinine, it has one advantage, that is no need for intravenous administration of creatine. It is synthesized in our body. It is freely filtered in the glomerular, neither reabsorbed by renal tubules. But there is some amount of secretion. That's why the value of creatinine are somewhat less. In case of male, 90 to 115 ml per minute. Female, 85 to 110 ml per minute, because of some amount secretion to the renal tubules. Third one is urea. It is freely filtered to the glomerular, but it has 40% reabsorption. So it is not good as compared to inulin and creatine. So best one is inulin. Only disadvantage we want to give intravenously. The inulin and creatine not affected by high protein diet, but urea affected by protein diet. The formula for calculating any clearance: Cl equal to UV by P. It will give creatinine clearance in ml per minute. U stand for urinary creatinine, V stand for volume of urine ml per minute, P stand for plasma creatinine. For calculating creatinine, we apply the formula CCR, clearance. Here creatine clearance equal to urinary creatinine volume of urine ml per minute, then plasma creatinine. It will give creatinine clearance. There is another shortcut to calculate the creatinine: Cockcroft-Gault equation. That equation name is called as Cockcroft-Gault equation. By this method, directly calculate creatine clearance from serum creatine value. CCR equal to 140 minus age in years int weight in kg divided by 72 into plasma creatinine mg per deciliter. It is multiplied by 0.85 in case of females. If the clearance value above 90%, it's said to be renal function normal. More than 90% clearance value means that renal function is normal. If it is 60 to 90% means mild renal impairment. If it is 30 to 60% means moderate renal impairment. Less than 30% means severe renal impairment. Less than 15%, it's said to be renal failure. That means end stage. This is how we can assess a glomerular function or filtration. Second test is assess glomerular permeability. Test for glomerular permeability is deduction of urinary protein is important. Nowadays, dipstick method is available. By using this method, we can easily assess urinary protein. It will give idea about glomerular permeability.